Good morning, listeners from Seattle. I am talking to a young woman today, all the way in Oklahoma. I'm going to pause for 1 minute. She didn't know I was going to do this.
No.
I'm going to pause for 1 minute to have a bit of a dual celebration. Last week, we are recording this in December, and for those of you who will watch the video, you will see that. Last Friday was a big day for me because it was my birthday, but it was a huge day for my guest. She had her last treatment for breast cancer. So I'm going to give her a little round of applause. That tap, tap, tap was a little round of applause, but I'm going to introduce her now so you know who I'm talking to. Her name is Lacey Terpstra-Reid. She's a registered nurse residing in Guthrie, Oklahoma. In November of 2022, she was diagnosed with triple positive breast cancer at the age of 33. Lacey has over 10 years of bedside experience as a nurse from working in a cardiac ICU where she cared for countless ECMO patients to her current role as an outpatient surgery recovery RN. Now, we're going to talk a little bit later about what that ECMO meaning is and why it's important to our conversation today. She's a young mom to a 2 and 3-year-old little girls. She spent the past year navigating her cancer treatments while chasing toddlers. So today, what we're really going to do, because she has recovered from breast cancer, from DIEP flap surgery, and she's a nurse, we're going to take both a personal and practical look at her recovery from breast cancer and having DIEP flap surgery. Lacey, happy holidays, Merry Christmas, happy last day of your chemo, and thank you for joining me today.
Thank you for having me. I feel very honored to be here. It's crazy. It's almost been a year ago, basically. I joined the journey, and wow, look at me here. This has really brought it full circle. I would never have thought I would be doing a podcast with you after listening to some of your podcasts when I was making my decision on what kind of surgery I wanted to do. So thank you for having me today.
Well, it's equally as fun for me, and I think it's who we meet in life along the way. And on this breast cancer journey, it there's an immediate bond whether you meet a person in person or whether you meet them long distance. Now, fortunately, we've had the opportunity to do both, and so that's why I'm thrilled to have you on the program this morning. Um, why don't you begin? Just give us a brief summary of your story, and we can talk, Lacey, about the emotional impact, how you plan for this with your family, what the impact was on your little girls. So I'm going to let you take over now.
Well, like you said, I was diagnosed with breast cancer in last November. My story is a little bit different for people my age. I didn't ever feel a lump. I was enrolled in a high risk program based on my family history. And because of that, we found the cancer early. I was very fortunate to be in that program. And after that, when I was diagnosed with triple positive breast cancer, the kind of first thing people do is chemo, and that was presented to me. The surgical option was presented to me as well. My staging on imaging um, uh, made it okay that I could make a choice whether to do surgery first or chemo first. And when you get diagnosed with breast cancer, it all happens so quickly.
Mhm.
And I immediately started researching, and the only thing I had heard about this point was implants, and I didn't ever want implants for me. And so when I heard that I would have more time to make a decision if I did chemo first, that's what I went with. And so I had more time and I had time to research, and I came across the DIEP flap. And that's when I decided that's what I wanted to do. It sounded more like long term. I'm very young. I didn't want multiple surgeries throughout my lifetime, because with implants, that was what would is expected,
Mhm.
replacements and everything like that, saying you have no complications. So I did chemo for 4 months. I did 6 rounds. I had a couple allergic reactions to chemotherapy. We had to change regimens right in the middle of it. So that was fun and scary and all at the same time. And I'm a nurse too. So, making those calls to these doctors and stuff. And I would get these, well, are you a nurse or are you a patient? Like, well, both. I'm a nurse, but I'm the patient in this instance. And so I finished chemo March, the end of March. And then my last week of chemo, my breast surgeon resigned from her position. So I had to find a whole new breast surgeon. So I
Mm.
had to wait a few weeks after that to get into a new breast surgeon. Got into them, and between her, my plastic surgeon, we decided to do a lumpectomy first. I
Okay.
still have lymph nodes that were very enlarged. And at that point, the plastic surgeon, Dr. Habash out of Fort Worth, Texas, he suggested that in case I did need the radiation. We did a lumpectomy. I had clean margins. So we planned, and a couple months later, I had DIEP flap surgery, August 8th. I'm about 4 months post-op with that, doing really, really well. I feel good. I'm back to doing all the things I can. I can even do push-ups now, which a month ago I couldn't even do a push-up. So I can do everything now.
Wow. Wow. Okay. We do a lot of podcasts, but go ahead and tell them why you can do push-ups from having deep. You saved your rectus abdominis muscle, right?
Yeah.
Yeah.
Yep.
Yeah. I mean, I think it's important for the listeners to know that, that's why we call it the gold standard.
Mhm.
Because, if it's done properly, if all the abdominal muscles, all the abdominal wall is preserved properly, then we can get back to things like push-ups, planks, sit-ups. So yeah, I'm glad you rolled that into the conversation. Way to go on your push-ups.
Thank you.
Yeah. You know, as you were speaking, I was thinking about something, Lacey, because we're very fortunate to have good medical facilities. So you had that in your favor. You
Correct.
also are a nurse. You are used to doing research. You're used to being an advocate, not just for yourself, but your family and your patients that you treat. So you had that in your favor. What advice would you give a woman? I'm throwing a question at you here. I know you're going to answer it well. What advice would you give women who don't have any of those elements, who don't have your medical background, who don't have their own voice? What's the strongest, you know, advice you can give them?
I mean, the strongest advice would, we live in a world where there's so much knowledge out there. And, if you tell somebody, do you know anybody who has breast cancer? Somebody might know somebody, and you might get some knowledge that way. Or if you get online through Facebook and you just type in breast cancer on Facebook, all these things will pop up. And it's been so cool to see for me how many nice people there are in the world, and how many people are actually willing to help you, drop everything. And it's hard to ask. And in my story, I didn't share a lot at the beginning, when I got diagnosed, but as I've opened up through this journey, it's been pretty awesome to see all the support and just the nice people. So just I would say talk to your family first. Have your family talk to people. Get in touch with somebody maybe who's gone through this journey. I've helped. I know a bunch of girls through in my own community. My surgeon has sent me through different things for chemo and cold capping and stuff like that. And so I have a little community of my own now as well.
I think it's all about community. And like you said, nobody has to go through this alone. I think the first thing, like you said, is you've got to ask the question. You've got to reach out. That's really sage advice. Thank you. Um, okay, what do you feel was the biggest emotional impact for your family? You have young girls.
That right there, my young girls, they're 2 and 3, and here I am with breast cancer at 33.
Mm.
You know, and your first thought when you're diagnosed is, am I going to be here, when they turn 5? Am I going to be here, for all the different things? Again, I'm so very fortunate. I was in a high risk program. We found it on imaging. um, One thing I would like to advocate for is for women like me with this family history to be able to get in these high risk programs easier um, than me. But
How did you find that? Tell us a little bit more about that, just so the
so,
listeners might know what to ask.
so my mom was actually diagnosed with breast cancer in 2019, and I
Mhm.
was pregnant with our first child at that time.
Okay.
And we both saw the same obstetrician doctor, and I went in for my 20-week appointment. Just checking up. You're halfway through, and she just was like, "Lacey, I'm seeing all these reports come. Like, this is probably breaking HIPAA, but we have to get you in a high risk program." And I said, "That's what I came to talk to you about today." And we just broke down and cried.
Oh,
And
wow.
I mean, at that point, she sent all over the referrals, like no questions asked. And they started calling me immediately to get me in. All the while, my mom was getting calls to get into the breast surgeon and the
Oh
radiologist
my
and
God.
just all kinds of different things as well. So that's
So ask the question to your breast surgeon or your obstetrician. If you have a family history, ask them, is there a high risk program that I could get in? Is that a good question to ask, do you think?
And what I tell people too is, if they are resistant to it,
Mhm.
tell them my story.
Mhm.
Say, I heard this girl, her mom had breast cancer, her grandma had breast cancer, her great grandma had breast cancer, and she got in this high risk program. And then 2.5 years later, she had breast cancer as well. And they caught it early. You know, I think that's the
That's
big.
that's the key, is catching it early.
Mhm.
Catching it early. I mean, there's no guarantees when it comes to breast cancer, but statistically speaking, we know the earlier you catch it, the better it's going to be.
Exactly.
Wow. We hadn't talked about that high risk program before. I'm really, really glad you brought that up, because I think programs like this, getting into clinical trials in breast cancer treatment, all of those things are important. You've just got to ask. And some
Yeah.
people, you know, I think of all our fear is based on what we don't know. So this is good empowerment today, what you're sharing with our listeners. So I really, really appreciate that.
Yeah, communication is key.
It is. It's so key. And, we sometimes have to find our voice. You're a very strong, I find you to be a very strong, confident woman, Lacey. And not everybody
Thank you.
has the internal, mechanism. And so I think listening to this sometimes gives other people that empowerment and that ability to ask. So that's really great. Yes. So, you know, when you say you're on the journey, to clarify for listeners, there is a Facebook group that I curate and have for a number of years, and we call it The Journey. It's a private Facebook group, and a lot of the questions on there are from young women, and they say, how am I going to manage this with little ones at home? So I have two questions for you. Physically, how did you manage it? Because that's a big question. But also, I know they're asking about emotionally, how do you handle it? And that's kind of twofold. How do you tell young children? Because you have to approach them at their developmental level. Okay, now I'm talking, my teacher comes out in me. You have to talk to them, with them at their developmental level. So how did you do this physically? How did you tell them and deal with the emotional aspect of a 2 and 3 year old or young children, toddlers?
Yeah. So physically, family support, that was huge. If I The surgery I wanted ultimately was the DIEP flap.
Mhm.
And to do that, I knew I would have a hefty recovery of 12 weeks. I couldn't pick up my children.
Mhm.
If I did a mastectomy with implants, I was told it would be 6 weeks. If I did a lumpectomy, it would be a week to 2 weeks for that. Um, Ultimately, long term, I always, if I ever got diagnosed with breast cancer deep down inside, just based on my family history alone, the mastectomy was the only option for me. And so with that, I already knew I was going to get a mastectomy. So I needed that 6 weeks of support no matter what. And then when I came across the DIEP flap, I knew I needed 12 weeks. And I'm very fortunate to have lots of family support, one being my husband, two being my parents, and my mother in law. My parents live very close. So if my husband's not around, they're here and they basically did all the heavy lifting for me. And that's one thing I will tell, somebody, if you don't have somebody to pick up your kids for you basically 24/7 during that time, then unfortunately this is an option for you right now. Later on, 100%. But right now, unless you have that support like I did, it's not an option. Because if you don't follow these instructions, the surgery could be totally ruined. And then you could be dealing with a lot more complications down the road and not being able to pick up your children even longer. So, following those instructions, one, is very important. So, physically, I didn't do things physically. Emotionally, I had time through chemo to kind of prepare my kids. They saw me sick through that. Um, you know, I'm very visual with them. I showed them. We talked about it. We watched shows like Daniel Tiger when mommy's sick. Um,
I love
uh,
Daniel Tiger. I've
I
watched
know
it with my grandkids.
has a life situation for almost everything,
Yeah.
Um, and afterwards, they saw me changing my dressings. They saw me stripping the drains. They saw how hurt I was, how strong I was before, and then how weak I was. And not hiding it from them, I think, is a big thing. I also work in a pediatric outpatient type of setting, and we do a lot of surgeries on the pediatric population. And every time a child comes in who doesn't know what's going on, they wake up terribly. But every time they know what's going on, they wake up and they're settled, and you're able to calm them down. And I approach that like my kids. I explained to them what was going to happen before, how long mommy was going to be gone, where my incisions were going to be at. We played with, I had an eye incentive spirometer at home. We played with that. I have pictures of my littlest doing it. And so, yeah, just having them see everything and not hiding it from them. That's how I emotionally prepared them as well, and
You
myself too.
know, I love this advice. You know why? Because again, as a teacher, I've had incidences in the classroom where children have lost a grandparent or there's been some tragedy in their family. And I'm like, you've got to be honest with your kids. They are
Yeah.
far more resilient than you think they are. And
Yeah.
Lacey, here's what I think too. They're like little adults because in my opinion, and why I have curated my Facebook page like I have, at the end of the day, I honestly feel like we want solid, truthful, transparent, evidence-based medicine. That's what you gave your tiny little muffins at home. I
Yeah.
mean, I love the way you said that. My little teacher, happy meter is going up here, listening to you talk about that. That was really beautiful the way you talked about it. Um, so briefly, can you tell us, you had triple positive. So what kind of chemo did you have? And also you mentioned the cold capping. I I'm
Yeah.
looking at nobody can see it who's listening, but when you look at the YouTube, you're going to see Lacey's gorgeous head of hair that she saved through cold capping. So it's not for everybody, but it's an option. Tell us about what kind of treatment you had and why you chose the cold capping. Kind of roll those into two.
Okay, so I started out doing chemotherapy. I started out with Taxotere and Cytoxan. I did those for 2 treatments. After both of those treatments, I developed a rash. My oncologist, it was very, very bad. It was this time last year I was dealing with it
Mm.
over Christmas when nobody was in office. So, anyways, 2 rashes, oncologist and her team in pharmacology, they decided that it was probably due to the Taxotere.
Mm.
So at that point, we switched to Abraxane and carboplatin for the rest of my treatments. Um, so the next 3 after that, that's what we did. I did have a complete response to chemo on imaging, and then further on with the lumpectomy with the clean margins as well. And then I was able to save my hair through all of that because I did cold capping. Um, Cold capping was something I never had heard of myself until I got diagnosed with breast cancer. And I'm sitting there like, I have breast cancer. And, then I come across it. And I start looking into it. And I think to myself, well, that's something I could do. I've always been very self-conscious about my hair. It's what I tell people, it's the thing I like most about myself.
For good
Um,
reason.
I was voted best hair in high school.
Okay, I'm voting you best hair now, post chemo, best hair, period. It's gorgeous.
Oh, thank you. Thank you. So, again, I reached out, I told a couple people, of my close friends that I had breast cancer, and I came across this cold capping thing, and they said, "Oh, we've seen somebody do that on Instagram. Let me send you their info." So, I was watching their stuff, and I just made the decision that I was going to do it. One, for me emotionally,
Mhm.
2, I didn't want to be sick. I didn't want to have my girls lose mommy. I didn't want them to, where's your hair? Where'd your princess hair go? My
Oh.
oldest is, really big on her hair. And if you know her, she's in the mirror brushing her hair all day long. And I didn't want to not look like me,
Mm.
and I know so many people go through that as well. I decided to try it, and I went into the mentality that if it doesn't work, that's okay, but at least I know I tried. Um, and then through that, you have to be super, super careful with your hair. You have to wash it under cold water. So for those 4 months during chemo and about 4 months afterwards, I was taking cold showers this whole last year. I mean, I would rinse
What
my
time
body
of the year
warm.
was that?
Well, I started my first chemo was December 15th, 2022. So
Okay,
all
did
winter
you
long.
did you have to go into that? Yes, ice baths are very beneficial because they do talk about that. We're not going into that topic today, but I'm thinking Oklahoma, December, the cold showers. I need a sip of coffee. I'm cold.
You also don't want, they say you don't want to work out or get your head hot for any reason. That could have hair loss as well. So chemo days were really busy and hard work for myself and then my partner. My partner ended up being my mom. She wanted to do that for me. She wanted to be there with me. We would put the caps on about 50 minutes before chemo started, all throughout chemo, and then for 4 to 5 hours afterwards. So I had these caps on my head that were negative 35 degrees Celsius. Although they couldn't get a positive number. If they got positive, then they would be too warm. So they were always a negative degree Celsius on my head for 9 to 10 hours a day through that.
Oh my gosh. Was
Yeah.
it heavy?
Not very heavy. It's the kind I use was like a little gel. It was a cap that fit perfectly on my head. I had to wear like protection on my skin so it didn't touch the skin here. I had to wrap my ears with protection as well so I didn't freeze my ears off. Um, the worst part was when they initially went on. The first cap doesn't feel the greatest. The second cap is kind of right there, but by the third, you don't even feel it anymore.
Okay.
So I also treated it as like, hey, it's my job. Like, I'm paying all this money. I'm going to do it at the best I can, and I'm going to try the hardest I can. And I just had that mentality all the way through. And I have all my hair.
Oh God, yes, you
It's there
do.
when I tell people that I had breast cancer. Like I had a patient yesterday and they were telling me about their cancer. And I was like, well, I had cancer too this last year. And I said, I don't look like it though. And then we started talking about the cold capping. And so, yeah.
I have a really big question to ask you. Is
Mhm.
cold capping covered by insurance? Because I have no clue. And
No,
and I
it's
see,
some,
okay. Mm,
yes.
you know what? We need to work on this, Lacey. Uh, maybe we'll make this our 2024 mission because I fought getting a wig. So, okay, 2002 is when I had my chemo.
You fought getting a wig?
Yes, I did. Okay, now we're getting our little patient advocate voices on here, aren't we?
Yeah.
We've had these conversations before in one-on-one. I did. I was on the phone so much about getting a wig covered. That's a prosthetic.
Yeah.
Now, that was in 2002. That was my experience. But to me, these are quality of life issues. These are emotional, traumatic things that women go through in insurance. I think I'm just going to say it out loud. I feel they should be covering that. That's just my little soapbox today.
Yes, I agree. And I hope to advocate for more and be a walking image of it actually does work for people. So,
Oh, wow. I'm so glad you shared that coal capping story with us because there are women that ask about that too. Okay,
mhm.
let's roll into your DIEP flap. You already told us why you wanted to have DIEP flap. And I really like the way you did kind of a verbal, but to me, it was a visual timeline of now and in the future,
Mhm.
and why you chose DIEP flap. What I want to ask you is how you went about finding your surgeon and what qualifications were you looking for?
So, the way you find any surgeon is referrals. You get diagnosed, and they for you over to a breast surgeon, and then that breast surgeon they probably work with a few plastic surgeons, and I had made the comment to her I didn't want implants that very first time I saw her. And she said, well, she's like, there's a couple options for you. Of course, first is lumpectomy. And I also made it a pretty strong case to her. I wanted to do a mastectomy. And she said, there's this other option where you can use your own tissue. And here's all the info. She didn't want to like force anything on me. She said, go talk to your oncologist, come back. And so I did. And I did a lot of the research myself. I got online and I looked up their page. I looked up all kinds of things, research. I looked up, found your page through that as well on Facebook. I've and read stories, and through that, I made my decision pretty early on that that's what I wanted to do. Um, and one big thing for me, I did not want to be away from my children for more than, a couple days. They're 2 and 3, and they are huge, huge mommy girls. So traveling was going to be very hard for me as well. I found all these other places that do it. And then, looking at their credentials versus the surgeon that I was giving, they were all the same. And so when I was referred over to them when I went and had my initial consultation here in Oklahoma City, if the doctors aren't in town, you don't get to actually talk to the doctors in office. So at first, I was kind of weirded out by that. However, then that doctor called me. And not only did he call me that day, he called me several different times to talk to me. And not only talk to me about my surgery, but just about what my life goals were, how, the longevity of this would be, about my lifestyle, about my health. He basically counseled me for a while. And these calls would last anywhere from, 20 minutes to an hour and a half.
Shared
So
decision making.
yes,
He was
yes,
building up that trust in you
correct.
by making you a part of the, yes, I love it.
Correct. So even though I never really got that in office experience with him, I still felt very confident with that. You can look up all the credentials and everything. That's easy to look up. But it's, when you speak to a person, when um, know what they're about, that's when you can build confidence. And that's how I did build confidence, and that's how I made my decision to stay with him and stay in Oklahoma City. He did counsel me on my health. After chemo, I was a little bit overweight, and he wanted me to drop the weight. And he said, here's these other places that aren't going to make you drop the weight. If that's not something you're interested in, here's them, and I will send all the referrals you need over to them. No questions asked. And I didn't want to do that. I wanted to be home. I knew he was good. And so I did all the things I needed to do. And I had surgery August 8th. And because of all the things he did, I'm not going to need a phase 2, which I think is pretty cool. And a big part of that, because he counseled me and made me lose the weight. If I wouldn't have lost the weight and did all the things, the likelihood, and like he said, that I would need further phases would have probably been higher than it was. But
So there's something I want the listeners to hone in on, is that this takes work. This takes work and commitment. But don't be afraid of it.
Yeah.
I'm feeling what you're saying, because I think about the work that I went through. And I don't know about you, Lacey, but when you know what to expect, when you are told all of the things that you need to do, and you're a part of the process, in some ways, it took the crap that you deal with from the diagnosis, the fear that you deal with, and it gives you a little bit of control. It's like, okay, I've got work to do now. I know what I need to do. And then when you do it, even with your little hiccups along the way, you had to change breast surgeons, you had a rash, you just keep going one step at a time, and you do get there. And my
Yeah.
gosh, look at you now.
Mm-hmm.
You can say, I did it, but you put in the work. I'm glad that you're saying this out loud. Um,
It's
okay.
not, it wasn't easy.
Thank you. Thank you for
There's
that trip.
lots of tears shed, but here I am. So,
Here you are. You did it. Bravo. Um, okay, so there's a couple of things I want to talk about in your recovery. One of them is ERAS. So you
mhm.
used ERAS. Just for those that are listening, it's enhanced recovery after surgery. I've talked to my own surgeon. I've done a podcast with him on that, Dr. Crisopolo. We're name dropping today because we want people to know about these good surgeons. And I can put a link to that podcast in the show notes too, just so people can research that or listen to that podcast. But tell us how ERAS helped you in your recovery.
So one, my all my bedside nursing experience, I am basically a post-op surgical nurse. So I have pushed ARIS all my career, basically. So I knew the benefits of it. I knew getting out of bed as soon as I could was the best option. In fact, as soon as I kind of came to in my room, I asked, "Hey, can I get out of bed?" And they were like, "No, not yet." And
Strap this woman down for a couple more hours.
yeah, pretty much. And I'm like, okay, well, I'm gonna do my IS on my own, and I was joking with my nurses. I was like, I'm probably your easiest one because you don't have to tell me how to do all the things I already know.
Yeah.
Um, just moving is so big for your lungs. You've just been through a surgery that's, anywhere from 6 to 10 hours. You've got to get your lungs opened back up. And so that's huge. Standing up, getting out of that bed, pushing that fluid out, breathing deep. Those are all important things. The faster you do those things, the faster you're going to get back to your normal self. And
Can I
so,
can I ask you a quick nurse question? Lacey, you're going to give a better term than I will. There's fine little hairs in your lung. What are those called? It starts with an E.
alveoli,
Oh, okay.
yeah,
However they're
cilia,
spelled.
and the cilia off of them.
Yes, and so the movement of those little hairs, they can't move unless you're moving. So you move, you get up, you do your breathing exercises. That's what gets your lungs clear and helps just get that air throughout your body, the oxygen throughout your body more specifically. I'm really glad you brought that up. Okay, I wanted to ask about those. Um, now this is a good segue. So you and I had a similar but not so similar experience. I'm going to ask you what ECMO stands for. And the reason I'm going to ask you is because you and I shared a common flap monitoring procedure or device. However, I didn't remember mine as well because when I had my surgery in 2014, like I think it was a year later, my surgeon, their group started using AirAss. So I had the pain pump and I was a little zonked out. I don't remember as much, but so two things. Tell us what ECMO stands for, and then why, because we both, there's different flap monitoring systems, but you and I both used the T-stat flap monitoring system. So tell us how this all relates. I'll let you sort that all out for the listeners.
So ECMO is extracorporeal membrane oxygen. What that means or does is you take the blood out of the patient's body, you oxygenate it in a oxygenator, and then you return the oxygenated blood back to the patient. Whether their lungs are working or their heart isn't working, they need help doing that. And doing that, it's very important to know the oxygenation of the blood on a venous side and an arterial side. So I am super familiar with all kinds of different oxygenation devices. And, when I came across the DIEP flap and they said, hey, they'll be monitoring you with these T sets, I saw it and I was like, oh, that's kind of what I used before. That's great. I even know the right numbers to read for that. So I found myself like that night, I couldn't really turn around in bed, but I would take my phone and, you know, get it on the camera so I could make sure that my numbers were right. I took a couple pictures to,
Checking the
the
monitor.
nurse in me was checking that monitor. Um, so yeah, the TSATs were used. I didn't personally have any problems with them, and I think that's most patients' experience as well. They worked great. My flaps functioned fine after 24 hours. They were taken off, and to this day, I've got great perfusion in them too. So yeah.
And so, for the listeners, one of the other fears that a lot of women have who go through DIEP flap is they wonder, how do I know my flap's gonna, live? How do I know it's gonna survive? And most surgeons these days have some kind of flap monitoring system. And the one that Lacey and I use does, it's a higher level, the T-stat system. And so I'm really glad that you told us about, because it's the oxygenation of a flap, and that translates into that survival of a flap. It's the blood flow in, it's the blood flow out, it's how those veins and those, right, how they are tied together, how they survive if they don't get any kinks in them. And that flap monitoring system on the breast is what does that. So, okay, what did I miss out on? Is there anything else you want to share with us as a young woman, a nurse who has survived triple positive breast cancer with young children, had DIEP flap, did all the things? What are we missing, Lacey?
The thing I tell everybody, like right now and where I'm at on my journey, is if you're just starting this, it's not easy in the beginning, and it's not going to be easy in 3 months, and it's not going to be easy in 4 months. But once you get that to that year mark, you're going to be able to take a deep breath. My oncologist told me there will be a time, my very first appointment, that I won't have to think about breast cancer every minute of every single day. I still don't have that. I still think about it a lot. However, through all of that, also what I tell people is I had a lot of good days too, more probably good days than bad. My kids, as hard as it was through all of this, they were really my saving grace. When I felt so terrible through a chemo, they pushed me to feel better. I had no choice. When I was down after surgery and I was slumped over, in the hunchback position, I wanted to get better, as quickly as I could for them. So young moms, your kids will be your saving grace. And you can get through it. I did. I didn't think I could, but I did it, and you can too.
I can't thank you enough. I mean, the transparency of your conversation today, the honesty, you have become, through all of your trauma in the last year, Lacey, you have become a shining example of what an advocate is for
Thank you.
those going through breast cancer and breast reconstruction. So I want to thank you so much for joining me today.
Well, thank you for having me. Like I said, this has just really brought it like full circle for me. So, I
I
mean,
have a feeling maybe we might have other conversations down the road to do a little more
yeah,
fleshing out of this advocacy work. But thanks
yeah.
again. Guess what? You're my last podcast I'm recording in 2023. I can't think of a better way. This probably won't go out until the new year, but that's an even better, more hopeful thing to look forward to in 2024. Happy holidays. Give those sweet little girls a hug, and tell your wonderful caregivers, your husband and your family, happy holidays. Eat a few more pieces of fudge or whatever this next few
Exactly.
days. Yeah, yeah. Enjoy those
Me
Christmas
too.
cookies. Yeah. So good to see you. Thank you, Lacey, for joining me today on the podcast. And we will also get this on the Deep Sea Foundation YouTube channel. Thanks again.
Thanks. Bye.
Bye.